please, if they have not partnered with NHIS already, they should do so for the sake of the poor Nigerians who may not have access to them. And secondly, how can they extend this treatment to those in rural areas? I'm sure that you respond to that. That's coming from Haji Aladi. Another one says, how can innovative cancer medicine and traditional methods be breached? Ambassador Caleb Lameri from Gindiri in Plateau sent that one. This one says, is the 18-month treatment continuous on a daily basis or based on a structural timetable? Another one says, can one with breast cancer from Enugu access this treatment? That's Amaru. My question is to Aisha Ejibo. How can a person with cancer get assisted to manage the cancer illness? All right. Another one says, are you recruiting patients currently for the study? What should be the responsibility of a patient who wants to be part of this? And lastly, how much will the patient pay? Who is the contact person and details for anyone to be part of this? Dr. Clement Adegbesing, it looks like you didn't start early, but of course, I'm sure Professor would, reiterate some of the things we already mentioned. So, Aisha, maybe you respond to some, then Prof would attend to the other questions.
I'll take easy ones. So starting with the last question, it is entirely free, right? The treatment, the testing, the diagnostics, everything is entirely free. And even in some cases, if there are issues, because like Prof said, we have patient navigators who are going to be calling these patients to check up on them to make sure they are fine. If there are cases where someone is even unable to afford transportation, there are provisions for that, right?
Wow,
so
great.
Yes, it's entirely free. Is patient recruitment ongoing? Yes, it is ongoing, and Prof had said this earlier. Reach out to the National Hospital Oncology Department. Maybe we can get a number to put out there. We have a flyer. You can come to the National Hospital, the Oncology Department, and they will take it from there. I also take the question of the lady, I'm not sure what was the lady, around cancer access generally,
yes.
right? I'm not a physician, but I was, in my interaction with them, so I'm not going to come from a clinical perspective. So what I will say is, first of all, see a doctor, right? Cancer care, it's not a one-size-fits-all. You would have a team of experts, right? You have a team of experts looking at what the best treatment is for you. From a programmatic or access point of view, I will say there are 24 cancer centers in Nigeria right now that are on the cancer access program I talked about earlier. I'm not sure where the person is called or send a message from, but there are those cancer centers where you can go to receive care at a much more subsidized rate. So, so that's the feedback I'll have for that person. First of all, access care, go to the experts so they can determine what your treatment course would look like. And then you can benefit from the cancer access program where we have negotiated rates for over 30 cancer medicines.
Yeah, I'm sure that's from the Cancer Fund. I think something like that exists. But Prof,
it's part of it.
Respond.
Well, she has literally answered most of the questions.
So but is it the 18 months? Is it a day-to-day? I think it's a question I talked about.
Yeah, there are maybe one or two things there. No, if you are in the rural area, for instance, yes, if you are able to come to Abuja and to the National Hospital, yes, you can be part of this study. So that is, it's for every Nigerian. So anybody that is able to access, because we can't go to the rural areas and do the treatment. But if the people are able to come to Abuja, then we'll be able to treat them.
And if you're taken, you have to be here for 18 months, right?
No. No. So it's a structured treatment.
Okay.
It's actually a 30-minute treatment. That is done every 2 weeks. Okay. So for 18 months. So every person will have about 36 cycles. So every 2 weeks you come, you take the treatment, and you go home. If you have any side effect, then you come back or you call. If it's something that we can tell you what to do while you are still at home, you do that. But if it needs for you to come, you come to the hospital. If there's need for admission, we'll admit you at no cost to you. We'll treat all the possible side effects or whatever is wrong with you at no cost to you, and so on and so forth. So it's free. And the last question, that's one interesting one, is the issue of immunotherapies and traditional medicines. Well, traditional medicines are, if you go to China, for example, and you walk into a pharmacy, you will see that 90% are really traditional medicine, while 10% are orthodox, and so they've been developing, they've been developing their traditional medicines. They've been doing a lot of research. So we want to see research around traditional medicine so that we'll be able to bridge that gap. But for now, this study is purely for this particular immunotherapy.
How many doctors are in this program? Are you the only one attending to all the 30 patients you've picked?
Certainly.
And then are all the doctors Nigerians, or you have?
Yes. So all the doctors are working at the National Hospital. I have co-PIs. I have about 5 doctors that are already on the study, and other people are also involved. If you have a patient, we have consultants at the National Hospital. When they have patients, they also send them to us. So it's a whole team. Like I said,
Nigerian doctors.
All of them are Nigerians, not only doctors, but also pharmacists, also nurses, patient navigators, data analysts. They are all Nigerians.